Can I use fillers for my under eye hollows with puffiness? Hi, I'm 35 years old. Ever since I can remember, I've had deep under eye hollows, and on top of it, I have tendency to have puffiness from time to time. So supposedly, I cannot have any fillers injected because of the hyaluronic acid in it. Please let me know if there is anything that could help me.
Thank you for your question. You're 35 years old and you stated in your question that you've had these hollows and that apparently you're unable to have hyaluronic acid. And with the photo you submitted, it appears that you have significant under eye puffiness. I'm a cosmetic oculofacial plastic surgeon. That means I'm a specialist with a background training in eye surgery and specialty training of plastic surgery of the eyes and face. So under eye bags is very much a lot of what we do every day. So let's understand why you're not a candidate for the hyaluronic acid. Now, if you have an allergy or some kind of sensitivity to hyaluronic acid, that's a separate issue. But it is also possible that the reason why you're not a candidate for hyaluronic acid is that the projection of the puffiness, I should say, under your eyes is too great to camouflage successfully with hyaluronic acid, with a filler like a Restylane, Juvederm, Belotero. So let's understand the reason why you're concerned about the hollows and the role of the puffiness. The puffiness represents something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the under eye area where there are fat pockets, the fat pockets push forward, and it creates a hernia. It makes the eyes look like you're always tired. Now, hollowing is a relative term. You have the puffiness, it's like a mountain. So what is adjacent to that mountain is a valley, and the valley looks deep in contrast to the mountain. Therefore, it stands to reason that addressing the puffiness can also improve the appearance of the under eye hollowing. So I'll explain to you what we would do in our practice for someone like yourself. If you're 35 and you have light skin, light eyes, then it is sometimes a combination approach that we do. We do a procedure called Transconjunctival Blepharoplasty. This is a procedure where we address the fat pockets, that means removal, repositioning, correction, to create the appearance as if you never had the puffiness under your eyes from the inside of the eyelid. There are many advantages to this approach. Although it's technically more advanced, it is basically avoids an external incision. It helps to reduce the risks of pulling down, a common problem with eyelid surgery, and it allows us the natural contour and shape of the eyes to be retained. And it's probably the most common lower eyelid procedure we perform for under eye bags. We combine this very commonly with a material that we derive from your own blood called platelet-rich plasma. The idea is that the platelet-rich plasma helps with wound healing, and it is based on the concept that the platelets, the cells in your blood, are responsible for when you get a cut and heal the wound. We've found that this material, injected in a specific way, will actually improve skin quality. So we're addressing not only the puffiness, but we're also improving any crepey skin quality issues under the eyes. It's all about synergy, and this is a great synergy in our practice. We do this procedure under local anesthesia with light intravenous sedation. That means you don't have to go under general anesthesia, and we do this all in our own private facility certified by the Joint Commission in our office. So it's the equivalent of having it in the type of facility you'd find in a hospital, but in the comfort of a nice boutique-y space in a doctor's office. A lot of times people are intimidated by the idea of going to a hospital surgery center because of the large numbers of people and the depersonalization. So this combination has been very successful for us in our practice. So I think that to summarize my recommendations based on your photos alone, transconjunctival blepharoplasty with something for skin quality improvement, including platelet-rich plasma. We also sometimes actually do something called fractional CO2 laser, which is a way to improve the texture from the external approach using thermal energy. But I think at this point it's best for you to move forward with meeting with qualified, experienced cosmetic surgeons. And I do lean towards specialists, being a specialist myself, compared to a more general or unspecialized general plastic surgeon. Again, depending on practice focus, there are plenty of doctors who are not cosmetic oculofacial plastic surgeon who do very good eyelid surgery, lower eyelid surgery, but it's a matter of you meeting with doctors that you feel comfortable with based on reviewing before and after photos, based on the method and technique and the type of anesthesia, and ultimately you have to feel connected with the doctor. I think that's very important. So I hope that was helpful. I wish you the best of luck. Thank you for your question.